because they know that the students who finish their exams are now going to be the new interns to replace those that have been used and now dumped. But we are standing together with the medical interns in this country who have delivered resiliently to this medical field, that they do that donkey's work when it comes to these hospitals. But now we are done using them and we've slapped them back to their fathers. I want Ugandans to understand that when these medical interns do not complete their internship, they're not going to receive practicing licenses. So they will never work anywhere. Not even in this country, not outside. Fellow Ugandans, this is a fight for us all. This is a national cause. This is a time that we stand with the people that we believe our lives are in their hands. Our lives are in the hands of the medical practitioners. If we continue to treat them whichever way we feel like, then let the people, that's when you're going to have these traditional doctors now doing surgeries, because we do not appreciate those that went to school for 6 years. And we are saying, come tomorrow, Tuesday, 14th December. If Dr. Mwebesa does not take back whichever letters he released, if we do not have the president of this country come out to give a formal statement, we are not afraid to put on these red suits and move to the streets. We are tired, we are fed up. The use and dump theory is not going to work. To the new interns that are being expected to replace those that were promised things are not done, do not go to those hospitals. Let us see who is going to replace them. Let us see who they will use. Thank you. I'll hand over to my Vice President. Are we going to do a Luganda version?
Yes. Yes, my name is Nelson Sewanyana, the Guild Vice President, Makerere University. I want to bring to your attention that these basic Ugandans we see out there, each and every person has a right to health. However, what is happening currently is that the government of Uganda is choosing to deny the Ugandans this right to health. I want you to understand the arch role that is played by the interns in the health sector of Uganda. When you go to the national referral hospitals, the regional referral hospitals, the general hospitals, the people who do every single thing you do, you see, are these intern doctors. They come from school after completing a bachelor's degree in medicine and surgery, a bachelor's degree in pharmacy, dental and nursing, and many other courses in the medical field. However, it is quite challenging that even after these people graduating, the government is choosing to treat them like students, and even students would have had a better treat. These people are graduated people, and they are just practicing under supervision. They are doing all the work, but the government is choosing to ignore these people. They are working in very poor conditions, that is, hospitals do not have where they stay in a huge part of this nation. Even at Mulago, very many of them do not have where they are staying. They just have to go and rent in the slums of Katanga, which is very unsafe. And they are asking for a very little pay, that is half the recommended pay for a doctor, even when they are qualified. And the government is just looking on the side and choosing to send them away from this training. So we are saying that this is very unprofessional from the Director of Health Services, Dr. Henry G. Mwebesa, and we are asking and saying that it is just prudent from a professional manner that he comes out and clearly recalls this statement, apologizes to the people of this nation and the doctors of this nation, and we should embrace the need for continuity, and this continuity can only happen if every single person in the system, that is the doctors, the interns, and then the pre-interns, can follow a manner that is well known. So if they think they are going to use the interns disguising to take in pre-interns on ransom, we are not going to allow that. As Makerere University, the university that churns out the highest number of medical interns every year, we are saying no, and we are not going to be part of this rape of the health sector. Thank you so much. Mu Luganda